10 sepsis warning signs that need immediate attention. If you believe sepsis only happens deep inside a hospital, to someone already hooked up to machines in an intensive care unit, you are wrong. And that single belief may be one of the most dangerous misunderstandings you carry about your own health, or the health of someone you love. Sepsis rarely announces itself in a hospital bed. It usually begins quietly, right at home, hiding inside something that feels almost harmless at first. A small cut you assumed was healing just fine. A mild fever you blamed on a passing cold. A cough that lingered a little longer than it should have. This video is for general educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you or someone you love is experiencing a medical emergency, please contact emergency services immediately. Sepsis develops when the body's response to an infection spins out of control and begins to injure its own tissues and organs instead of simply fighting off the invading bacteria, virus, or fungus. It can move from a minor concern to a life-threatening emergency in a matter of hours, sometimes even faster, which is exactly why recognizing the early warning signs matters so much. Every year, this condition affects millions of people around the world, and many of them never imagined that something as ordinary as a urinary tract infection or a skin wound could ever become this serious. Throughout this video, we will walk through 10 signs that doctors and nurses watch for closely. Signs that are often taught in medical training precisely because they can appear before more obvious symptoms show up on a monitor. Toward the end, we will look at one sign that is so often overlooked, so easy to dismiss as something else entirely, that many families later say they wish they had known about it sooner, because recognizing it in time might have changed how quickly they sought help. Before we get into the signs themselves, it helps to understand what is actually happening inside the body, because that understanding is what makes these signs make sense rather than feel like an arbitrary checklist. An infection, whether it starts in the lungs, the urinary tract, the skin, the abdomen, or somewhere else entirely, normally triggers the immune system to respond in a targeted, controlled way. White blood cells rush to the site of infection. Inflammation helps contain the problem locally, and the body typically handles things without much disruption to the rest of the system. In sepsis, that response becomes disproportionate and spreads far beyond where it is actually needed. Chemicals released into the bloodstream to fight the infection begin causing widespread inflammation throughout the entire body instead of staying contained to one area. Blood vessels can become leaky, allowing fluid to escape into surrounding tissue. Blood pressure can drop as a result, and organs that depend on steady blood flow, like the kidneys, the liver, the lungs, and the brain, can start to struggle to keep up with their normal functions. This is why sepsis is sometimes described by clinicians as the body turning against itself while trying to defend itself, a kind of friendly fire happening on a cellular level. What makes this condition especially difficult to catch early is that it can follow almost any kind of infection, no matter how minor that infection first appeared. A scraped knee, a bladder infection, a bout of the flu, a dental abscess. None of these sound alarming on their own, and in the vast majority of cases, they resolve without any complication whatsoever. But in a small percentage of cases, for reasons researchers are still working to fully understand, the immune system's response escalates rather than resolves, and that is when these 10 signs become critically important to recognize. Now let us walk through them, one at a time, starting with a symptom that many people assume works only one way. Number 1, a body temperature that swings to an extreme. Fever is something almost everyone associates with infection, and for good reason, since it is often one of the first things a doctor asks about when someone calls in feeling unwell. But with sepsis, temperature does not always rise the way people expect. In some cases, particularly in older adults and in people with weakened immune systems, the body temperature may actually drop below normal, a condition known as hypothermia, which simply means the body is losing heat faster than it can produce it. This is one of the more confusing aspects of sepsis. because a low temperature can seem like the opposite of what an infection should cause, leading some people to assume nothing serious is going on, or even that the infection is improving on its own. Margaret, a 78-year-old woman living alone in a small town in Ohio, had been fighting what she thought was a stubborn urinary tract infection for several days, treating it with over-the-counter remedies and plenty of rest. Her daughter called to check on her one evening and noticed Margaret's voice sounded unusually weak and slow, nothing like her normal energetic tone on the phone. When her daughter arrived at the house not long after, she found her mother wrapped in several blankets, shivering uncontrollably despite the warm summer evening outside, with skin that felt cool and slightly damp to the touch. A thermometer reading showed 95 degrees Fahrenheit, well below the normal range of around 98.6 degrees Fahrenheit. That unexpected drop, rather than a spike, turned out to be an important clue that something more serious than a routine infection was unfolding beneath the surface. Any body temperature that is unusually high, unusually low, or accompanied by shaking chills and uncontrollable shivering may be worth discussing with a healthcare professional, especially if it follows a known infection or a recent illness that seemed to be improving and then suddenly took a turn. It is also worth noting that temperature alone rarely tells the whole story, which is part of why medical professionals are trained to look at temperature alongside several other measurements at the same time rather than in isolation. A slightly elevated temperature during a common cold is rarely cause for alarm. A temperature that spikes very high, very quickly, or one that drops unexpectedly low while someone is already fighting an infection, deserves closer attention, particularly when paired with any of the signs we are about to discuss next. Number 2, a heart rate that stays persistently fast. A racing heart can happen for countless harmless reasons, from a strong cup of coffee in the morning to a stressful afternoon at work, and most people experience it without any lasting concern. What makes a fast heart rate more concerning in the context of sepsis is persistence, meaning it does not settle back down the way it normally would once the triggering activity or stressor has passed. When the heart continues beating well above 90 beats per minute, while a person is resting quietly, sitting still, or even lying down, and there is no obvious explanation like exercise, caffeine, or anxiety, it may reflect the body's attempt to compensate for dropping blood pressure or reduced oxygen delivery to tissues throughout the body. This happens because as blood vessels widen and leak fluid during the inflammatory response we described earlier, the heart has to work harder and faster to keep blood circulating to vital organs like the brain, the kidneys, and the liver. It is essentially the cardiovascular system trying to make up for a circulatory system that is losing pressure and losing efficiency at the same time. Think of it like a water pump working overtime, because the pipes carrying that water have started to leak along the way, forcing the pump to push harder just to maintain the same flow at the other end. A consistently elevated resting heart rate, especially alongside other symptoms on this list, may be associated with a developing infection that has moved beyond the body's ability to contain it on its own, and it is generally a signal worth paying close attention to rather than dismissing as simple nervousness or fatigue. Family members caring for someone recovering from an illness at home often mention this sign almost as an afterthought, saying something like their loved one's pulse just seemed to be racing all afternoon for no clear reason. That seemingly small observation, when it appears alongside a known infection, can actually be one of the more measurable and objective clues available outside of a hospital setting, since a heart rate can be checked easily with nothing more than a watch and 2 fingers placed gently on the wrist or neck. Number 3, breathing that becomes fast, shallow, or labored. Watch closely how someone breathes when they are seriously unwell, and you may notice something subtle before they even say a word about how they feel. Rapid, shallow breaths, sometimes more than 22 breaths per minute, can indicate that the body is struggling to get enough oxygen into the bloodstream or is trying to blow off excess carbon dioxide caused by a buildup of acid in the blood, a state clinicians sometimes call metabolic stress. Breathing is one of those bodily functions we rarely think about consciously, which is exactly why a noticeable change in its rhythm or effort tends to stand out so clearly to anyone paying attention. Family members often describe this sign in ordinary terms rather than medical ones, which is part of what makes it so valuable to know about in advance. They might say a parent seemed to be breathing like they had just run up a flight of stairs, even though they had simply been sitting quietly in a chair reading or watching television. Others describe a kind of visible effort, where the muscles around the neck or ribs seem to be working harder than usual with every single breath. This kind of unexplained breathlessness, particularly when paired with a fever, a known infection, or general weakness, may be a signal that the lungs and the rest of the body are under more strain than appears on the surface at first glance. It could be helpful to seek a medical evaluation if breathing changes appear suddenly and do not have an obvious cause such as physical exertion, extreme heat, or a panic response. Counting breaths for a full 60 seconds while someone is resting calmly can offer a simple, practical way to notice whether something has genuinely changed, and it requires no special equipment at all, just a clock or a phone timer and a few moments of quiet observation. Number 4. Sudden confusion or a noticeable change in mental clarity. This is one of the signs doctors describe as easy to miss because it can look like ordinary tiredness, especially in older adults who may already seem to tire more easily than they once did. A person who is usually sharp and articulate might suddenly seem foggy, forgetful, or unusually quiet during a conversation that would normally flow with ease. Others may become agitated, disoriented about where they are or what day it is, or unable to answer simple questions they would normally answer without a moment of hesitation. Robert, an 82-year-old retired schoolteacher from a small suburb outside Pittsburgh, Pennsylvania, had been recovering from a minor case of pneumonia at home under his wife's watchful care. His wife later recalled that he asked her the same question 3 times within the span of just a few minutes, something completely out of character for a man who had spent 40 years running a classroom with sharp attention to detail and an excellent memory for names and faces. She initially chalked it up to exhaustion from being sick, assuming a good night's sleep would set things right again. Looking back, that sudden shift in mental clarity was one of the clearest signs that his infection had progressed into something far more serious than a simple case of pneumonia running its usual course. Confusion tied to an active or recent infection may indicate that the brain is not receiving adequate oxygen or blood flow, since the brain is remarkably sensitive to even small changes in blood pressure and oxygen levels compared to many other organs in the body. It is generally worth discussing promptly with a healthcare provider, particularly because the person experiencing the confusion may not recognize it themselves, which makes the observations of family members, friends, or caregivers especially important in catching this sign early. Number 5. Pain or discomfort that feels disproportionate to the situation. Pain is subjective, which is part of what makes this sign so tricky to interpret both for the person experiencing it and for the people around them trying to help. Someone experiencing sepsis may describe a level of pain or general discomfort that feels far beyond what their underlying illness would typically explain, even to someone who has dealt with that same type of illness before without much trouble. A minor skin infection might suddenly feel unbearably painful to the touch. A stomach bug might come with abdominal pain severe enough to make standing upright or even taking a deep breath extremely difficult. Clinicians pay close attention to this kind of disconnect between the apparent severity of an illness and the intensity of the pain being reported, because the body's inflammatory response during sepsis can amplify pain signals throughout the nervous system in ways that are not yet fully understood. When a patient or a caregiver says something along the lines of, "This hurts so much more than it should for something so small," that statement is often treated as clinically significant rather than dismissed as simple exaggeration or a low pain tolerance. If pain intensifies rapidly or feels unusually severe, compared to what would normally be expected for a given illness or injury. It may be worth seeking prompt medical attention rather than waiting to see if it improves on its own over the following day or two. Trusting that instinct, the simple sense that something about the pain does not add up, has proven to be a genuinely useful signal in many documented cases. Number 6. Skin that turns pale, clammy, or develops a mottled pattern. The skin often tells a story long before words do, and it happens to be one of the easiest signs on this list to observe without any special training or equipment. As blood flow is redirected away from the body's surface and toward vital internal organs, a survival mechanism the body relies on during many kinds of physiological stress, the skin can become pale, cool, and damp to the touch, even without any physical exertion to explain the sweating. In more advanced cases, a blotchy, lace-like pattern known as mottling can appear, particularly on the arms, legs, or knees, caused by uneven blood flow beneath the surface of the skin as circulation becomes less consistent throughout the body. A home health aide caring for an elderly client in Central Florida once described noticing that her client's hands had taken on a strange purplish, web-like appearance that had not been there earlier that same morning during her first visit of the day. She had never seen anything quite like it in her many years of caregiving, which prompted her to call for medical help right away rather than waiting to mention it during her next scheduled visit. That instinct, trusting an unusual visual change rather than assuming it would resolve on its own, may make a meaningful difference in situations where sepsis is developing quickly and quietly. Any sudden, unexplained change in skin color or texture, especially alongside fever, weakness, or a known infection, may be worth having evaluated by a medical professional as soon as reasonably possible. Because this sign is visual, it can often be documented with a simple photograph on a phone, which some caregivers have found useful for showing a doctor or nurse exactly how the skin looked at a particular point in time, especially if the appearance later changes again before a medical appointment. Number 7. Blood pressure that drops lower than usual. Low blood pressure, medically referred to as hypotension, is one of the more serious signs on this list because it often signals that sepsis has progressed to a stage requiring urgent medical care rather than simple observation at home. As blood vessels widen and become leaky during the inflammatory response, blood pressure can fall significantly below a person's normal baseline, sometimes causing lightheadedness, blurred vision, or a distinct feeling of being about to faint, particularly when standing up quickly after sitting or lying down for a while. This drop in blood pressure is part of why sepsis can escalate so quickly into a condition called septic shock, a more advanced and dangerous stage where blood pressure falls so low that organs may not receive enough blood flow to function properly, sometimes leading to lasting organ damage if it is not addressed quickly. Medical teams treat a significant drop in blood pressure as one of the clearest signals that a situation has become urgent, often prioritizing fluids and other treatments specifically aimed at restoring blood pressure to a safer range as quickly as possible. A blood pressure reading that is notably lower than a person's normal baseline, especially when combined with dizziness, rapid heart rate, or confusion, may indicate a medical emergency that should be evaluated without delay rather than monitored quietly for a few more hours to see how things progress. For anyone with a home blood pressure monitor, checking readings during an active illness can provide useful, objective information to share with a doctor, particularly if a reading seems unusually low compared to what that person typically sees. Number 8. A noticeable decrease in urination. This sign is often overlooked simply because it takes place quietly, without any dramatic outward symptom that immediately grabs anyone's attention the way a fever or a racing heart might. When the kidneys are not receiving adequate blood flow, they slow down the amount of urine they produce in an effort to conserve fluid for the rest of the body, prioritizing organs that are considered more immediately essential for survival. Caregivers may notice that an adult has not needed to use the bathroom in many hours, far longer than would normally be expected, or that urine appears unusually dark or concentrated when it does occur. In a hospital setting, nurses often track this measurement closely, sometimes hour by hour, because it can reveal kidney stress before blood tests confirm it through laboratory results. At home, this sign is easy to miss unless someone is paying close attention to a loved one's daily patterns and habits, which is part of why caregivers of older adults or chronically ill family members are often encouraged to keep a simple mental note of how often bathroom trips are happening during an active illness. A significant, unexplained reduction in urination, particularly during an active illness or in the days following a surgery or hospital stay, may be a meaningful indicator that the kidneys are under strain and may be worth mentioning to a healthcare provider, even if it seems like a minor detail compared to more obvious symptoms happening at the same time. Number 9. Overwhelming fatigue or weakness that feels different from ordinary tiredness. Everyone feels tired sometimes, especially while fighting off an infection, and most people expect a certain amount of fatigue to come along with being sick. The fatigue associated with sepsis, however, is often described by patients and families as qualitatively different from ordinary tiredness, a heaviness or weakness that makes even simple movements, like lifting an arm, turning over in bed, or holding a phone to talk, feel unexpectedly exhausting. Dorothy, a 69-year-old grandmother living just outside Austin, Texas, was recovering from what seemed like a routine gallbladder infection following a minor procedure a few days earlier. She told her son over the phone that she felt like her body had turned to lead, unable to explain it any more precisely than that simple comparison. She had always been an active, independent woman who prided herself on doing her own gardening and grocery shopping well into her late 60s. And that single phrase stuck with her son long after the phone call ended, because it did not sound like normal tiredness at all coming from someone he knew so well. When fatigue becomes severe enough to interfere with basic daily functioning, especially in someone already dealing with a known infection or a recent medical procedure, it may be a sign the body is under more strain than expected from that illness alone, and a conversation with a medical professional may be appropriate sooner rather than later. Family members are often in the best position to notice this shift, precisely because they know what that person's normal energy level looks like on an ordinary day. Number 10. A sudden sense of impending doom. This is the sign we mentioned earlier, the one that so many people overlook, because it sounds more like a feeling than a measurable medical symptom that could show up on a monitor or in a blood test. Some patients describe a sudden, unexplainable sense that something is seriously wrong with their body, even before other symptoms become obvious to them or to anyone standing nearby. It is not simple anxiety or ordinary worry about being sick. It is often described as an intense, almost primal certainty that something is dangerously off, a feeling that can be difficult to put into words, but is remarkably consistent across many different patients who have gone through it. Emergency medicine professionals take this feeling seriously precisely because it has shown up so consistently across patients experiencing sepsis and other severe medical emergencies, like heart attacks, where a similar sensation has also been reported and studied. Researchers believe this sensation may be tied to the body's stress response and subtle internal changes that a person can perceive even before they can consciously identify what exactly is wrong, almost as though the body senses trouble before the mind can put a name to it. If someone expresses this kind of sudden, intense feeling that something is seriously wrong, especially during or after an infection, it is generally advisable to take that statement seriously and seek medical attention rather than dismissing it as simple worry or an overreaction to being sick. More than one emergency physician has noted that this particular feeling, vague as it sounds, has turned out to be one of the more reliable warning signs reported by patients who were later found to be seriously ill. Taken together, these 10 signs rarely appear in isolation, and no single one confirms sepsis on its own without further evaluation. What matters most is the pattern that emerges when several signs show up together, a fever that will not resolve, a heart that will not slow down, confusion that seems to come from nowhere, skin that looks different than it did that morning, breathing that seems more labored than the illness alone would explain. When several of these signs appear together, particularly following an infection, an injury, a surgery, or a hospital stay, it may be time to seek medical evaluation promptly rather than waiting to see if things improve on their own over the following hours or days. It is also worth remembering that sepsis can affect anyone, at any age, though certain groups tend to face a higher risk than others. Young children, older adults, people with chronic conditions such as diabetes or kidney disease, and anyone with a weakened immune system due to illness or certain medications may be more vulnerable to developing sepsis, following an infection that might otherwise resolve without complication in a healthier individual. This does not mean healthy young adults are immune to it, only that awareness matters for absolutely everyone, regardless of age or general health. One statistic captures why this awareness matters so much. Sepsis is estimated to contribute to as many as 1 in 5 deaths worldwide each year, a striking figure that places it among the most significant medical concerns of our time, and outcomes tend to improve significantly when treatment begins within the earliest hours after symptoms appear. That window of time, often just a few short hours, may be one of the most important factors in determining how a case of sepsis unfolds, which is exactly why recognizing these 10 signs early, rather than waiting for them to become undeniable, can matter so much for the people we care about. If this video helped you understand something you did not know before, we would love to hear from you. Has someone in your life experienced sepsis, or noticed one of these signs firsthand in a parent, a grandparent, or a friend? Share your experience in the comments below, because your story might help someone else recognize these signs in time to seek help sooner. If you found this information valuable, consider sharing it with a friend or family member, especially anyone caring for an older, loved one or someone recovering from a recent infection, and subscribe for more educational content like this in the future. Thank you for watching, and take care of yourselves and each other.